Washington, D.C.'s health outcomes are among the worst in the nation for many of the primary diseases of concern. We seem to celebrate disease a whole lot more than we actually speak to health and wellness. And so if we promote wellness, we can actually do a great job of preventing disease and reducing some of these poor health outcomes. My name is Vigilance, and I'm the director of the DC Department of Health. There are three basic functions of public health: promotion, prevention, and protection. And as the director of the department, I'm here to ensure that the department actually makes sure that those things are done on a regular basis for the residents of the district. So how do we pull all this together? This is a time where a lot of municipalities are undergoing significant budget pressures, and as a result of that, there are budget gaps that need to be filled. They're very, very hard decisions for us to make. Health and Human Service departments need access to resources so that we can actually do the things that are necessary for people to live full, healthy lives.
I think the challenges Dr. Vigilance faces in Washington, D.C. are similar to what every local health officer is facing. The particular problems may be different, but trying to allocate scarce resources to address growing problems. It can be obesity, it can be HIV, it can be hypertension, it can be diabetes. And until we provide local health departments and local communities the resources they need, we're not going to see the end of these very sad statistics.
Multiple lumps over here, exactly.
This year, as we speak, 7,000 public health jobs have been lost by local health departments across the country. And we are expecting at least that many jobs to be lost next year.
What we spend now, on average at the state level, is about $34 a person. CDC spends about $17 a person. Let me give you context. $34 a person per year is less than an oil change for your car per year. We ought to spend a lot more on our health than we do on an oil change.
The history of public health is having discovered over the last couple of centuries that there are public health interventions that both make sense and that pay off in healthier communities.
I think that there are a number of opportunities in this time of economic downturn for us to make better use of prevention, because the more we're able to engage communities in raising their level of knowledge around health and health threats, the things that they're at risk for on a daily basis, then we can do a much better job in the long run of preventing those diseases and their bad health outcomes.
Like if she doesn't want to do a lot of milk, she can just do like 8 ounces in the morning with cereal.
With the environmental issues that go into being healthy, such as open space in communities for kids to play in, safe space for people to walk in or interact, good access to fresh food. If we combine all those things, then we have situations where we've got to deal with many more social determinants of health than just the healthcare system.
The cost of our health care has weighed down our economy and our conscience long enough.
These times, we have to make the smartest decisions we can with our money. Where will we get the most health for the dollar we're going to spend? We have done some work that shows that proper investments in public health will save us $5 within 5 years for every $1 invested. That's terrific. A 500% return, we all wish we would have that in our 401k.
This is budget stuff.
Our economy into the future is unsustainable if we can't get control of our current health care costs. Public health is about real dollars saved and about good investments made. And when one looks at Dr. Vigilance, what one should see is a committed professional with a mind oriented to giving the people who live in his jurisdiction the healthiest lives that they can live.